Hello guys, this is TJ Smith. Today I'm going to be performing a sterile dressing change and I'm also going to get a wound culture too. So I'm going to start by my general principles and safety practices. I'm going to check the order, make sure I got the right patient that needs the wound to be changed, and to obtain a wound culture as well. I'm going to approach the room that the patient's in. I'm going to knock, identify, explain what I'll be doing, and then begin assessing the patient. So I'm going to check the ID band while I'm here. Name and date of birth match up there, so we're good there. I'm going to also assess for pain. If the wound is causing pain, I'd administer an analgesic, but right now the patient's not in any pain, so we're not going to do that today. And then I believe I'll put on some gloves and then grab myself a biohazard bag. So got my biohazard bag here. So now I'm ready to pull this dressing off. I'm going to gently pull it off using the push-pull method. If it's not coming off as easy, I'd use sterile saline as an adhesive remover to remove the dressing. So now I can assess the drainage, look at the type, amount, color, and odor, if there's any. Then I can discard this old dressing in the bag there. So now I can take my gloves off and get my sterile field ready. So take this off. I'm only going to grab the corners of this dressing and let it fold out in front of me. And only grab the borders. Okay. And I'm going to gently over and position it as needed. And then I'm going to grab my culture kit right here, and then I'm going to drop it 6 inches from the drape just to keep it sterile. Okay, now I can toss this too. Okay, so now I can put on my sterile gloves. So I'm gonna start with my right hand, only pinch and grab the inside of the glove. And then if this were to roll down, I would grab new sterile gloves and repeat this step. So this one, I'll cuff it. Just gotta find the thumb, slide my ungloved hand in. Okay, then I can adjust as needed, only touching the outside of the glove. Okay, so I'm to this point, so I can start picking my stuff out without crossing my field or doing any of that. Only touching the inside of the container here. Okay, so to this point, I'm ready to clean the wound. So I got some swabs here that I could use to clean. I go from top to bottom. So I can start with one swipe from top of the wound and down. Discard that swab. Then I can go to the side here without crossing the wound, at the left side of the wound, and then the right side of the wound here. Swipe on the right side, discard those, keep my hands above my waist, and now I gotta pat dry. So I take these guys with these tweezers and pat the wound until it's dry. Okay, now I can discard these as well. So now I can get my culture. So get this, pop the top off of that, and then grab this. And then I'd apply it to the wound, at least once in there away from non-necrotic tissue, and apply pressure to kind of get some drainage out, excess drainage out. And then I can pull up and then insert it back into the tube without touching any of the sides. And I'm just going to drop that on the bed. Okay. So now I'm going to go ahead and put a new dressing on. So I got a new one here. I'm going to place it there. I'm going to tape all 4 sides of that. And now I no longer need to be sterile. So I can go ahead, date, initial, and time that new dressing. And on this tube, I get a patient sticker, make sure your name and date of birth match up with their wristband. Put the site there. If they're on any antimicrobials, I would note for that as well. And then initial and date. So initial, date, site, antimicrobials, patient name, date of birth. And then I put this in a biohazard bag and send it directly to lab. Do that. And then patient's dressing's brand new, so I can go ahead and cover her back up and go ahead and throw this stuff away in the proper place, depending on facility policy. So I can toss all this in the biohazard bag. Toss all that in there. And shut these gloves off. Okay, cover the patient back up. Follow my general principles and safety practices. Lower to bed, call outs within reach. I'd wash my hands. The patient's nice and comfortable. Extra room form hand hygiene. That culture was sent to lab, and then I'll report and record what I just did. Thank you.